minutes to come in as we prepare to chat all things Tuesday, hormone shift, and more. And we are live on TikTok. Let's go live on Instagram as well. We'll give everyone a moment to come on in. And while you're waiting, if you're already here, maybe just put a question in the chat if you've got one. That way we'll have a chance of getting to it. We didn't announce this live, but I just wanted to go on. I'm getting so much great feedback and commentary about the hormone shift. So thank you guys all for reading the book and sharing the book and talking about the book with your community and your family and your friends. Obviously, I'm super passionate about this topic, and so much so is that I actually posted last night on why somebody in integrative and holistic medicine wants to talk all things hormones. And I think it's really important to know because there's been some chatter and some back and forth about, who should be talking about hormones, who owns the space, who really is the right person to go to. Like, I'm hearing a lot of this stuff, right? And I wrote this book for you guys to really be empowered no matter who you're having this conversation with. And it's interesting because just as confusing, maybe, or seemingly confusing, some of the hormone information is, it becomes even more confusing when you've got specialists kind of locking into space and saying this is right and that's wrong. And what everyone, and my point of writing this book, and really what I want everyone to understand, is that you can't have a singular focus on hormones. It's not just about the endocrine system or your GYN system, right? When we really broaden kind of our lens and we look at your entire health, we understand that hormones impact so many different aspects of your health. All right, as more of you are coming in, I'm Dr. Taz. If you haven't met me before, and I know I have new followers across the board, so thank you so much for jumping in and joining today. I am excited you're here. My latest book, The Hormone Shift, if you haven't seen it or haven't picked up a copy, is all about hormone balancing and hormone health from puberty through menopause and beyond, but takes this very holistic approach, a very east-west approach, where we talk a lot about what it means to merge the best of Eastern and Western medicine together, and how your hormones and other aspects of your health communicate with each other, talk to each other, and really impact how you feel, how you think, and what you do. And I think it's very important for all of us to understand this. And so medicine, right, if we pull back for a minute and think about it, medicine since about probably over the last 50 years or so, medicine has become highly specialized, highly fragmented, and the experience of having that GP or general practitioner or partner in your health, that has slowly gone away, right? So in fact, there was an article, was it yesterday? There was an article talking about how GPs are going away, how the fact that GPs are going away is actually driving healthcare costs up because there's no quarterback. There's nobody to pull back and look at the whole picture. And so while people want to own the hormone space, right, and chip off and say, I do hormones, or I do menopause, or I do perimenopause, I'm here to tell you it's not possible. You can't chip our bodies off into different pieces or different fragments and then assume it's not related to everything else. So you've got to have that quarterback. And that quarterback has to be a medical provider who's equipped to have those conversations and has the time to have those conversations, right? A lot of times what we see in the medical system is that there's just not time. There's not time built in to sit there. But what we've been doing now for, it's hard to believe because I date myself, but what we've been doing for over 15 years at Center Spring MD is exactly that. We've had longer visits. When I was new, I used to take forever because this information was even new to me, and trying to piece together everyone's lab work and connect the dots was painful and slow. But now, 15 years later, and once you're able to see so many patients, right, 35,000, 40,000 patients across about 10 to 12 different providers over the years, and we continue to grow and we continue to expand, you have a methodology, and I've got a way, and that's what you've got in the hormone shift. You've got literally my brain and the methodology of how we piece together the best of Eastern and Western medicine. We put it together and we're able to systematically make good decisions for you. So that's why, you need to understand the information. You need to understand how it's all connected. I feel like every day, even yesterday, I was talking to a woman, and again, it has nothing to do with your access to care. This is across all kind of markers of race and socioeconomics and even countries and so much more. across the board, what's happening is this fragmented form of medicine is being practiced. And across the board, we've got specialists kind of locking in, owning their particular territory, but not communicating with each other. That's not what happens in our patient interactions in my clinics, right? There, we literally spread everything out. We're looking at hormone data, gut data, nutrient data, inflammation markers, autoimmune markers, genetics to understand your risk for cancer, and so much more. And we're putting all of that together to really get the answer for you. I was talking to a woman yesterday who was tested BRCA negative, no, sorry, BRCA positive, and her friend was tested BRCA negative, both of them in their early 30s. Well, the one that was BRCA negative actually went on to get breast cancer, whereas the one that was BRCA positive did not. However, the diagnosis of being BRCA positive scared her so much that she's had a hysterectomy, she's had a mastectomy, she's had everything taken out, everything taken away at an early age, and kind of lives in a lot of fear. That's what I walked away with. There's just a lot of fear here. And so, again, we can spread this message of fear when you're not looking at the body in its totality, because it's not just about BRCA, and it's not just about one genetic marker. It's about how that marker gets turned on. And it can get turned on with stress, it can get turned on with poor diet, it can get turned on with environmental toxicity, or it can get turned on with so many different factors. So it's really important for you to really nail down your chemistry and understand your health. So I wanted to talk a little bit about that. So when you're talking about hormones and you're thinking about hormones and you're trying to figure out where to go or what to do, I would encourage you guys, you're not just looking for a hormone doctor, you're looking for somebody that can put the pieces of your health together. And hormones are a massive piece of the puzzle, but we've got to understand how they interplay with the gut, your liver, with your emotions, with your diet, and so much more. And a lot of that is laid out in the book. So hopefully that will help you to navigate that territory. So hoping that's helpful information. The other thing I wanted to talk about today, which was on my mind, was talking about, in the book I do this, I lead you down a road to help you identify your dominant hormone pattern. And one of the things that I keep seeing again in practice, and I still see patients and I love seeing patients, and I learn from each of you every single day. But one of the things that I see in practice is that there's some key hormone patterns, they're dominant hormone patterns, and we talk about this in the book and try to kind of guide you into identifying your dominant hormone pattern. But I could probably narrow it down very quickly into the three primary or three main ones that I see over and over again. And one is having sort of this confluence of insulin resistance and high androgens. The second one is estrogen dominance. And the third is more of my depletion patients that have crashed their thyroids and actually have very low progesterone, low thyroid hormones, and then everything else is secondary to that. So for each of you, you want to sort of figure that out. And for the guys that are watching, because I know we've got some guys here too, a lot of these concepts, you could read some of the chapters in this book and apply a lot of these concepts to you too, because the idea around gut health and liver health and insulin and blood sugar and environmental toxicity and even the emotional component of it is very much tied right back to what your hormones are doing. You may not have as many, you may not be cycling quite as much as we are, but they are very similar principles overall. So just keep that in mind for the guys. So even though I keep talking about women and women's hormones, it kind of applies to you too indirectly. But anyhow, one of my sort of challenges to you guys this Tuesday is to try to find that dominant hormone pattern. What is it for you? Because I think then you can sort of, fashion your diet, fashion your exercise. What are you supposed to take? You can kind of start to put these pieces of the puzzle together. One thing I'm noticing for sure is that those of us that have insulin resistance and that tendency towards high androgens, if our cortisol is not in check, then the heavy exercising actually makes things worse. It's actually causing more belly fat, more issues with overall blood sugar regulation and fat storage and metabolism. So that's why, again, we got to figure out the main idea, the main principle. If insulin resistance, for example, is your main idea, then it's eating at consistent intervals, eating breakfast, lunch, dinner, having a nice 12 to maybe even up to 14-hour period of gut rest, right? And then doing exercises that move the body, full body workouts that burn energy, but don't necessarily tax your adrenals. So things like, yoga, swimming, Pilates, walking briskly, a little bit of interval training, but not to the point that it's like at HIIT or Orange Theory, right? So a little bit of balance there until your cortisol level is in check, and then you can start to challenge the body a little bit more. So anyhow, so those are some of the things that were on my mind today that I wanted to share and jump in and talk about. I also wanted to know how you guys are doing with the hormone shift, with any feedback. I want to encourage you, if you have loved the hormone shift, to pass it on, right? Pass it on to a friend, pass it on to your daughter. As I said, I start in the very beginning in puberty and work our way through menopause. Pass it on to everybody and really make sure every woman you know has this information and has this knowledge, and so that they're aware of kind of what's going on with their bodies and they can really, really advocate for themselves. Finally, I want to remind everybody that tonight we are doing my coaching session for the Superwoman Circle. So we've got a lot of great new members in the circle. It's a community where we come together, we break down everyone's questions and ideas, but we always lead with an expert. So you walk away with at least one tool in your box when you're trying to take care of yourself. So tonight we will be talking about adrenal fatigue and cortisol, how it impacts your thyroid and your overall health. Next month we'll be talking about thyroid, and the month after that we'll be talking about leptin, which is the hormone that really regulates our appetite, very much involved in fat storage. So we're going to jump into that. So lots of exciting things planned in the Superwoman Circle. If you haven't joined yet, I encourage you to do so. The links are in my bio, or it's just drtaz.com/superwoman. In fact, we can type it out over here in the comments so you guys have access to it, but you still have time to join and to join us tonight. And I think you'll love it. I think you're going to really learn from each other and really have great ideas. For example, when I say get more protein in, a lot of times somebody else in the group has a hack or something that they use to get more protein in. Or if you're having trouble sleeping, again, sharing hacks that help with sleep. So really fun community. We meet tonight at 8 p.m. I hope to see you there. And those of you who have already joined the Superwoman Circle, you should have the link in your bio and be able to join us tonight. So that's exciting, and I love doing it. I love it's always fun to meet people outside of the exam room, right? I mean, I think the exam room is a very structured visit, but it's always, I almost call the Superwoman Circle and a lot of what I do kind of like after the exam room, right? If this was like a post-bachelor type special, this is after the exam room. What happens next? What happens when you go home? What happens when you open your refrigerator? What happens when you open your pantry? I was talking to a woman last night too, and this gave me pause as well. She was talking about this idea of food shame and food guilt, and that she just has developed these behaviors where she snacks and she munches all the time. And I put her on a detox. We do this 10-day detox at our center at Center Spring MD, which is amazing. I did it as well. And it's absolutely amazing. Really clears out cravings, cleans up the liver. Really is a great way, by the way, if you guys are thinking about hormone replacement. It's a really great foundational way before you begin HRT, because it's a good gut liver reset. It's a 10-day detox that we have on our website at Center Spring. But she did the detox, and she did well for a little while, but then boom, her cravings came right back, and this behavior pattern that she had of sort of munching and snacking all through the day, because she spent the majority of her time in the kitchen because she's a mom, and that's where everybody gathers, and that's where everybody chit chats and all that other stuff. She can't break that habit. And then she was in this cycle of feeling really shameful because intellectually she knew better, right? But emotionally, she couldn't control her behavior. So we talked a lot about why and how important it is to do things that actually make you feel good, because then your behavior will line up with what you already know. And so she probably, like many women, and honestly, nurturing men as well, was not doing enough that made her feel good, filled her up. So she was constantly resorting to this sort of trained behavior now. So we talked a lot about that as well, and I talk about that some in the book too. So anyhow, I don't know if any of you relate to that. We may address some of that tonight, but I think that's an interesting topic too. And remember, if you guys want me to talk about anything in particular, whether it's on social or whether it's in our community, please feel free to DM me and let me know. I really want to create content that serves you and really makes a difference in your lives. All right, I'm going to stop there for a second. I think we have a couple of questions. We're going to take those. Let's see, guys, can you find?
Yeah.
Okay.
So the first question is, how do you lose weight when your doctor says it's hormonal and genetics?
Oh my goodness, weight. So many women frustrated and men frustrated with weight. So, hormone and genetics, well, you want to follow that up, right? Which hormone, what hormone is off, and what do you do about it? Just like we talked about, if you are in one of those three patterns, and I actually have a 30-day reset in the book that you could follow to help you sort of figure out which plan is best for you. But if you are, for example, insulin resistant, high androgens, then your eating plan and exercise plan needs to match that hormone pattern. On the other hand, if you have estrogen dominance, then your entire regimen needs to match that. But if you're low in progesterone and have a crashing thyroid, well, that needs to be dealt with. So, yes, hormones and genetics are responsible for weight, but we can do things about it. We can change it. And that's exactly what I talk about in the hormone shift.
Okay, and then all of my weight stays in my stomach. There has to be a reason for this shape.
Yes, belly fat is sort of the shift as you hit, and actually I used to say as you hit your 40s, but I'm seeing it in younger and younger women all the time now, and men, by the way, and kids. And I think belly fat is a direct reflection of what your blood sugars are doing. So if you're eating a lot of processed foods, a lot of junky foods, the liver's getting boggy, you'll get belly fat at any age. But what happens at, 35, 40, 50 is that as estrogen and progesterone levels start to go down, cortisol, insulin, and blood sugar starts to go up. So our sort of distribution of body fat changes. We start getting more midsection fat and we start holding on to it there. So for the first time, many people start to notice that they have a gut or they have a stomach. And so that's really a call to shift what you're doing. It's a call to shift the way and the style of eating, that you need to eat clean food, liver supporting foods. You have to regulate your blood sugar. That's where I really love using like a glucometer or a glucose monitor. It seems to make a really big difference with helping you understand what your blood sugar is doing. I'm about to put mine back on. I was traveling a bunch, so I was holding out, but I'm about to put mine back on to understand what my body's doing. But these are ways for you to understand why it's happening to you. We know why it happens across the board, but what specific behaviors of yours might be involved, and we can hopefully get the information we need from there.
Okay, and I took the dominant hormone quiz in your book.
Yep.
I'm estrogen dominant and also insulin resistant. What should I do next?
All right, so you took the quiz and you're estrogen dominant, insulin resistant. So start with eating, get tons of fiber to help you break that estrogen down, use digestive enzymes, eat every 4 hours or so, and then you're going to have to stay active throughout the day because that combination of estrogen dominance and insulin resistance makes the body very sluggish. So it needs 10 minutes of movement, burst of activity all throughout the day in addition to your regular workouts to help you to bring the blood sugar down and to help you metabolize the estrogen a little bit better. I actually do recommend a detox for some of you that have both of those because it does help to clear the excess estrogen out of the system.
All right, and our last question.
Yes, good questions, guys.
I've been trying to figure out why I have the worst bloating reflux since starting the patch 2 years ago.
Oh,
Saw your book post, just checked my 23andMe and have the MTHFR SNP.
Okay, so the question is about going on estrogen and then having a lot of bloating post estrogen therapy. This happens to me too, by the way. The reason it's happening is you're not metabolizing the estrogen. You're holding on to it. So you need very low doses, and then you need a lot of liver support if you're going to be on hormones. So I like doing things like milk thistle or calcium glucarate or even DIM a couple times a week to help you metabolize that estrogen a little bit better, or just you need less. You can't do a ton of estrogen. So keep that in mind. That's a huge reason why we'll see bloating and even more, sometimes weight gain, honestly, with estrogen replacement therapy. All right, did we get them all? I have one on YouTube that I might get to. Let's see. I need more info on hypothyroid and Hashimoto's. Okay, so I think it's Luana on Hashimoto's, and hypothyroidism, I'd encourage you to join my community, because we actually are going to dive into that next month in November and talk all things thyroid. So that might be a great way. But read the Hormone Shift as well. It's a good introduction into how it's connected to gut health, inflammation, how those two things in turn influence what your thyroid's doing and how you can put all of that together. All right, I think we got most of the questions, right?
Yep.
All right, for everybody else, maybe I'll see you tonight in the Superwoman Circle. Remember, you can follow the link in my bios to join. We're going to be talking cortisol and adrenal fatigue, and I get to introduce you to Dina, who works with me, and will be helping us with a short little meditation that you can use to really help release maybe some of the emotional blocks. So look forward to seeing you there. Continue to let me know your feedback on the Hormone Shift, and if you loved it, don't forget to put a review. I'll send you a free bottle of Boost. We'll see you next time.